Today we've moved from a year ago. We were just in green stage with our index case. We've now come into red stage where COVID-19 is now prevalent with community transmission. And so from those PHAs, CEOs and chairmen, one or two have spoken already. You've given indication as to you are active, you are functional in the face of resource constraints, the hospital facility constraints, as well as the growing pandemic and our people's behavior in terms of their complacency to what is now a medical concern in our country. So let me from the outset place my on record my appreciation to every one of you PHAs in the front line. You've been there serving our country, our people, and also was trying your very best to maintain our other health sector is not abandoned, whilst running and being defensive in protecting our country from COVID-19. You also been maintaining our every other health services. So from those of us here at National Control Center at the National Office in Waigani, including Health Minister and Health Secretary and everyone, we'd like to say thank you very much to every one of you out there in the frontline areas. And to all our chairmen of our PHAs, this is not a paid job. You've volunteered to be on this job, so I thank very much all the chairmen nationwide. Many of you are women and men in your own, you are talented in your own professional areas of work. Most of you are also in private business, but I sincerely thank you all for volunteering your time to give service to Papua New Guinea, our country, your country, in as far as sharing the important structure of health service to our country. So thank you all the chairmen also. With COVID-19 from our front, let me also inform our PHAs in the interest of not compromising our regular health services. I have through and in discussion with the Health Minister and Cabinet, we've asked our Health Secretary to restructure. I think the structure is already there, but put a specific emphasis to PHA daily oversight and control and management linking to COVID-19. So there'll be one specific Deputy Secretary in charge of COVID-19 matters, and the other Deputy Secretaries will continue to run whilst having concurrent interest in what is happening in COVID-19. They're specifically concentrating in all other health sectors. So there'll be one specific from the National Control, one specific Deputy Secretary, liaising, interfacing with you PHAs, and every day in respect to COVID-19, but bridging to every other health services and sectors. And so that's just an indication to you. We're also looking at trying our very best to, at the moment in the last 1 year, whilst the National Pandemic Act gives us the operational framework, there has been no organic body that sits full-time in our national control coordinating COVID matters, COVID-19 matters. We're looking at going back to Parliament to set up a specific structure that is full-time having a handle on COVID matters, because the way it is going, COVID now has expanded, community transmission, which is have to address it in the whole of government approach. So we're looking at thinking something not as permanent and as fixed as national health. Sorry, I beg your pardon. The National AIDS Council we have, but something similar. So we have a permanent authority, permanent structure that goes out and have a handle on COVID-19 going forward until we bring this COVID-19 case to be arrested, stabilized, and contained. So these are, from the headline perspective, something we're doing. I've given my clear instructions to National Health Department and National Control Center. Our 3 strategies now going forward, and I want all of you PHAs to embrace it. PHA, by the fact that you have a autonomous sort of arrangement and you function in an autonomous manner, you have ability to assist us to deliver a specific tailor-made COVID-19 response in where you are in different parts of our country. And so 3 headline intention of us in our endeavors to stop COVID-19, our non-clinical Our non-clinical measures must continue to be run effectively, and that includes isolation and effective policing of isolation strategy. And I take with keen interest Dr. Stella's view on what is happening in a very hot spot in Sundown. Controller, you have to take a special interest in this one. Dr. Stella said there's no effective policing in as far as the non-clinical aspect is concerned. We're keeping people from unnecessary movements, the border crossing, district to district, unnecessary loitering, unnecessary movement in the main urban areas. These are sort of areas we need to move in. So to all our PHAs nationwide, non-clinical aspects in handling and treating stopping COVID-19 from spreading is one strategy at the very earliest. Our second strategy, of course, would be ensuring that our clinical strategies work up. And I need a specific report submitted to the National Control Center for our whole of government mobilization of resource to ensure you are supported based on the plans that you submit. So going back, first focus for us the non-clinical measures, especially stopping people from moving around, congregating, living in the nuclear manner in which we've now already promulgated. And our second strategy, how do we get our hospitals, our clinical treatment stepped up, testing facilities, isolation beds, in those isolation beds or ICU beds that we need to plant, develop, and I'm happy that some of you have already built isolation beds or ICU beds. We need to know how many beds you need to be planted, including the specialists or set up ICU wards that we need to expand. Your plan needs to come into us now, and including in your plan, if I could respectfully ask, the acquittals of whatever resources that you've been given already last year, if that can come in with your own plan in respective hospitals in respective provinces, national government stands ready to also mobilize resources to come and not just waste money but fund exactly the plan that your respective PHAs submit in efforts to fight COVID-19 as well as deliver everyday health services to our people in the provinces that you locate in. So I ask you, provincial PHAs, your plans, if it hasn't come into our National Control Center and our Health Department yet, then your plan must come in. Associate your plan with the acquittals of last year's funds and other disbursements that has come to you. And for us at national government, we're willing and ready and able to try to demobilize money and send to you, and for you to also step up in as far as not building fancy hospitals right away, the immediate need, assist in isolation areas, assist in the ICU beds that you need to put, assist in mobilizing oxygen ventilators if you need be, assist in stocking up the gene expert machines you have with the cartridges so that testing is going on, assist in the non-clinical areas where isolation of those suspect cases or established cases are being earlier dictated, isolated from the society, kept in areas. And you would note Minister Wong did indicate earlier on my view that if we have not yet established isolated areas, the districts and provinces have already been given money for SME, and I've been indicating to our members of parliament and our governors, those funds could be used to work with your PHAs in those guest houses and those little lodges or even houses around where hospitals are. We could identify them as isolation areas for those who are already being identified as COVID cases, but mild COVID cases, or those who present and show up symptoms of being possible COVID cases, so that you have these individual tailor-made strategies in your respective areas. And we want to stop people from moving around, isolate people as much as we can, and treat people or care for people who've been identified as COVID cases right across our country. So I ask you all in my concluding remarks today, the non-clinical strategy must be refined and control assist in that space. The clinical strategy, Health Department, Health Secretary, PHAs, assist in that space. If we must build now, the last 45 years, only 200 beds nationwide in as far as intensive care unit bed is concerned. This is statistics not good when faced with pandemic or endemic outbreaks. This is unsustainable for us as a nation. I am now ready to mobilize resources using COVID-19 to ensure we expand immediately bed spaces, bed size, stock up with the necessary kit, including oxygen ventilations and etc. you need for your hospitals nationwide. And so come up with those game plans now ASAP. We wasted last year in not doing much. We cannot waste any more time. We need to know what you need and where we could support. We will give the funding matched, trying to our very best match on what you need out there in the hospitals, whether it's provincial hospitals or strategic district hospitals, to embrace and fight COVID-19. And we get on with the business of trying our very best to arrest COVID-19 from further spreading and causing damage to our country. Now this brings me to my last point on vaccination. Health Department has now is working on a program to ensure these 8,000 vaccines, or some of them, in fact most of them, that we will be mobilizing for or sending out for health workers. Our PHAs must now identify the candidates of workers in our health sector who needs this vaccine, and Health Department find a way to send the vaccines out of Port Moresby very quickly to those PHAs and the frontline workers. Of the 8,000 that is coming, at least 6,000, 7,000 must go out to health workers. The other 1,000 or so we will keep for those who are essential workers to keep our economy running in our country. So that will be the manner in which distribution takes place. But I've already dispatched letter, and we're thankful WHO, our DFED partners, are all sensitive to the need for additional vaccines, and we are working to mobilize additional vaccines. But whilst those are being mobilized, the system in which vaccines is being delivered to all our health facilities and all our health hospitals nationwide must be established ASAP. And when vaccines or more supply of vaccine come, vaccine must go out to those who need vaccines, those who want vaccines, especially in the first instance, all our health workers who need to be vaccinated. So I conclude with these three remarks in summary. Please, each provinces through PHAs, hopefully your PHAs, and I make this commentary to our CEOs and chairmen, the governors and members in most instances will not come to you. Make it your business to go to them, present your case. You need these additional resources. We've given them resources to the districts and provinces. They have some element of resource or some resources at the district treasuries as well as provincial treasuries. So you already in the provinces, your provincial control center, a subsidiary of our national control center, I would assume has already been set up the last 1 year. In the provincial control center, you would have the provincial police commander, the provincial administrator, and the provincial the CEO of the Provincial Health Authority. The three of you are the key person in the provinces. The provincial health advisor or the CEO of the Provincial Health Authority will present to the provincial administrator and the PPC what needs to be done in as far as additional resources or policing of the isolation strategy that we've talked about. And in the instance of Wainumu as an example, Dr. Stella basically said there's no effective policing on the ground. These three officers in respective provinces, and we already have 20 provinces. NCDs is well stocked, and in the eyes of the National Control Center, and the exchange is going on very active all the time. And you have Bougainville. If Bougainville is functional, if the rest of our 20 provinces is functional, in as far as the Provincial Control Center is concerned, and what you need is advice to us, and we try to the best of our ability, mobilize support to download to you. You take lead in delivering health services and fighting COVID. I'm sure we could arrest what is now a spike. We could stabilize and try to contain and live with COVID going into the future. So I ask each and every one of you, wherever you are, please, chairmen of PHAs and CEOs of PHAs, you tailor your game plan that we need to follow here in Waigani. Waigani will not tailor the game plan for you. At Waigani, we just control the standards, vaccine standards, the Nubla passing standards. And some of you wanted more DPM to respond and all this sort of thing. We will assist from Waigani, but you in the front line, you tailor what is the specific bubble in which you operate in as far as COVID is concerned, whilst caring for the other health sector in your provinces, and we will try our absolute best to support you where we can. Today, all you health workers out there and those of us who care for health of our country, COVID presents us an opportunity to mobilize resources for health sector as never done before. As I said earlier, 200 beds only for ICU nationwide is a very appealing statistic. I want to use COVID as a time to build more ICU beds or more wards and more beds for hospitals nationwide. Send us your game plans. We stand ready to assist. Thank you very much. God bless. Happy Easter. Easter is an opportunity for us to on our own lives.